All right, the Association of American Medical Colleges is sounding the alarm right now on federal funding cuts and how they could impact healthcare across the country. In its new report released this morning, the group says, quote, federal actions represent an existential threat to the nation's medical schools, teaching hospitals, and biomedical research institutions. For more on this, we're joined by Dr. David Skorton. He's the president and CEO of the Association of American Medical Colleges and joins us from Washington with more. Doctor, this is a pretty sobering report, finding that cuts will have a significant impact on academic medicine. Break down for our viewers what that means and how it will impact them.
Errol, thanks a lot for your interest in our report. And I want to tell you, after roughly 45 years in the profession, I am really worried about a perfect storm. And just for the viewers and listeners, let me just make sure everybody understands what academic medicine is and what the AAMC is. We represent the medical schools of the United States that give MD degrees, and that's training tomorrow's doctors. We also represent the places that do biomedical research. About 60% of the research done, funded by the National Institutes of Health, are done by our institutions. And then thirdly, very, very importantly, we deliver patient care, and the kind of care that you want to see there 24/7 whenever something comes up, especially something complicated. And in all my years, I must tell you, this feels like a perfect storm where policies that are being discussed and possibly promulgated may hit all three of those missions: our ability to train the next generation of physicians, our ability to give patient care right now, this minute, and our ability to do biomedical research to set the stage for the kind of patient care that we have to give in years to come.
It's interesting you speak about that perfect storm, Doctor, because medical professionals across the spectrum have so many different types of concerns these days about what's happening with these cuts and coming from the federal government. What type of patients, which patients will really feel the brunt of these cuts first, do you think?
Well, there's so many different things happening, Errol, and I really appreciate your question. It's a very important question. Let's say those who are currently supported by Medicaid and depend on this healthcare mechanism, healthcare coverage mechanism, to be able to get healthcare when they need it, to go to an office and to have their diabetes managed or whatever it might be that they are dealing with. If Medicaid is cut in the way that is being discussed right now, the Congressional Budget Office estimates that as many as 11 million people can come off the Medicaid rolls. Now, what will happen? That means they will not be able to get to a physician's office to get some care until things get worse and worse and worse, and then they may need to go to an emergency department. By the time they get to the emergency department, they have a more severe issue, and we want to grab this issue earlier. We want to help prevent things from getting worse. So that's one thing that I think is very, very important to talk about. Then I want to talk about training the next generation of physicians and discussion of eliminating certain kinds of loan programs, graduate loan programs, and loan forgiveness programs could affect close to 50% of those aspiring to a medical career. And I had some of those loans many, many years ago when I was a medical student. And if we wipe out these kinds of loans, we're going to be making it hard for some people to aspire and achieve that medical career. And then very important about research, the way we are able to deal with things now that we didn't even know we could imagine dealing with, for example, immunotherapy to bring people back from the brink, from the edge, and cancer, heart disease, all kinds of things. We need to be able to do robust research that is directed by the curiosity of what comes next. What do we have to understand next? And the cuts to the NIH budget that are being discussed would be catastrophic. So whether we're talking about training the next generation of physicians, giving patient care right this minute, or discovering things that would help us understand and give better patient care tomorrow and tomorrow and tomorrow, I'm terrified by what's going on.
That's a sobering remark. I encourage viewers to look into your report so they can understand the impact this will have. Dr. David Skorton, thanks for joining us.
Thank you very much for having me, Errol.